Welcome to Keeping London Healthy. I'm your host, Dr. Mario Elia. We have a great episode lined up for you today. We're going to be talking with pediatrician Dr. Michelle Danby, and we're going to be approaching this from the standpoint of what kind of things do parents and kids want to be considering kind of as we come out of the worst of the COVID pandemic into the school year, and what kind of things should we be thinking about from a pediatric perspective from your health. So we'll be talking to Dr. Danby, and we'll be back right after this message. Welcome back. Thanks again for joining us today, and we're excited to have with us a guest, and she's a local pediatrician, Dr. Michelle Danby. Thanks again for joining us today, Michelle.
Hi, no problem. Thanks for having me.
So if you can tell us a little bit about yourself.
Yeah, so I have a community pediatric practice here in London. I trained in London as well, so I've been here for a long time. I also work at the hospital in pediatrics in the newborn nursery, so I'm checking all the newborns before they're discharged. And yeah, it's been a busy year or so.
And Dr. Danby is a classmate of mine, so we go way back
we do go way back.
So always have this is one of the cool things about the show, right? We've had a few guests on that have been kind of colleagues through training coming up, and now that we're all grown up and have some expertise on this, it's kind of cool to be able to provide this to the public. So I guess we'll start with kind of, obviously you're talking to parents every day and dealing with kids. What are some kind of the more common questions that you're hearing from parents with concerns?
Yeah, so probably the most common one is, when is there going to be a COVID vaccine available for kids under 12? And if it's available, should we get it for our child? Also getting a lot of questions now around school, and is it safe to go to school? What precautions should we take with sending our kids to school? And then another big one is kids that are in daycare right now, which will be the same case for school when it starts, is, my child has a runny nose or these symptoms. Do we need a COVID swab?
And I know certainly in our practice, we've seen kind of an uptick in viruses in the last month, I think. What have you been seeing in your practice?
We definitely had a huge decrease in them over the last year just because of social distancing and quarantines. Now that, things are opening up and kids are at daycare, people are seeing each other again, the normal sort of cold viruses are circulating in the community. So we're still seeing a lot of people, especially kids, with just their, regular colds and coughs and things like that. And the tricky thing is with COVID is most kids who get it, thankfully, have mild symptoms, but it makes it really tricky because we have no way of differentiating like COVID versus a regular cold and without a swab. So
you mentioned the kind of daycare and the runny nose and what are you generally telling parents? Let me ask you
so as per the public health guidelines right now, any one symptom, including runny nose, does need a swab before going back, just to make sure we're not spreading it around if they were positive for COVID. That's sort of a common misconception as well, because I do get a lot of calls to my office saying, my child has a runny nose, can you write a note for daycare saying they can go back? But really I can't without a negative swab. There's very few situations when I can do that if there's a clear reason why the symptom is there that's sort of not infectious, so teething or seasonal allergies or things like that. But in general, if they have a cold, they have to get swabbed.
Yeah, and I know it's been obviously inconvenient for not just inconvenient, but no parent wants to see their kid getting
for sure.
getting a swab,
I know,
but it is impossible for us.
It's necessary. Yeah, it sucks, and I've had to get my own kids swabbed a few times, but we have to do that just to prevent spread and just make sure everybody's safe. And I think that's sort of the trade-off of having kids being allowed to be in daycare and school.
The one thing I've reassured parents too, I know if they've had the nasopharyngeal swab, which basically the tickling the brain swab, that's the one we can do for kids. We do a combined nasal and oral.
Exactly. And that one's a lot easier and less, traumatic and painful. So that's a lot better.
One question I like to ask any specialist, I'll ask you being a pediatrician, what are some things that you wish, again, separate from COVID, that you find yourself educating parents and kids about kind of frequently, that you kind of wish everybody would know, like if you had a chance to tell everyone?
Yeah, for sure. It's a good question. So outside of COVID, I think the big one that came to mind is fever management. So, especially with the colds going around, and those can cause fevers, and sort of letting them know that a fever in itself isn't a medical emergency unless it's in an infant under 2 months, but in an older kid, the first step is just managing the fever. So Tylenol or Advil to kind of get the fever down. That usually makes kids feel a lot better in general. And then outside of that, making sure they're drinking fluids and staying hydrated, making sure their breathing's okay. And if they're able to do that at home, then they don't need to sort of rush to the doctor's office or the emergency room, when it first shows up. Obviously, if it's, prolonged, we usually say 5 days or more, then it should get checked out. But a lot of times parents will ask me, like, what temperature do I need to go to the emergency room? And it's like, there's no, number cutoff. It's not like at this temperature you have to go. It's like, what's more important is, can it come down with medication? Is it responsive to medication? And how is your child otherwise feeling? Are they drinking? Are they happy? Are they breathing okay? If that's the case, then you don't have to be as worried.
And one thing I guess parents don't often realize is that, short of there being an obvious bacterial illness,
exactly.
Most illnesses that we see, if the kid, over 2, we're taking a fairly conservative approach, considering most of these are viruses too. So
exactly.
And around thermometer selection, any kind of guidance you give them with that? I know.
And that gets tricky too, because there's a lot that are marketed to parents and they're very expensive, and parents will buy them and then they'll be disappointed that it's actually not the greatest one. But I would say the one to avoid is sort of the forehead one. That one's really not great. We do use it sometimes for like general screening, but not for an actual like accurate measurement. For infants, the most accurate is a rectal temperature, which a lot of parents aren't comfortable doing, which is understandable. But that same type of thermometer that can measure that can also be measured under the armpit, which is sort of the next best. And an older child over 5, you can do it under the tongue, because they're able to sort of cooperate and close their mouth. But armpit's fine for them as well. So I would say invest in an armpit one. The ear ones are okay, but for younger kids, they're not great because their ear canals are just so small and you can't straighten it out enough to actually get an accurate measurement to hit the tympanic membrane. So I usually say armpits best.
2 things that now that I'm a parent, I appreciate more, and my guidance to parents has changed. One is a rectal temperature, which I now realize is very difficult to acquire, and very difficult to do even as a parent.
Totally.
The second is urine culture bags.
Yes.
Popping it on and you're just going to go into this bag, no problem. That is very difficult to do as a parent.
Yeah, and that's so true.
And a lot more,
I know, and I totally agree, and that's a good point. If we're looking for a source of fever, like you said, those rare situations where it is a true bacterial infection that we need to treat with antibiotics. So one would be an ear infection, which we have to physically look in the ear. So it's very hard to do virtually. You'd have to see them in person to rule that out. And then the other one is a urinary tract infection. So the bag sample, it's not a sterile sample, so it's often contaminated with bugs that naturally live on your skin. So, it's a screening. If it's negative, then it's negative, that's great. But if it's positive, you have to kind of do a catheter sample, unless your child's old enough to pee in a little cup for you, which the toddler range is not usually. So that's when the bag gets really tricky.
It's the adhesive on those bags, not as advertised.
No, it doesn't work very well, unfortunately.
Absolutely. So now that, obviously during COVID, booking in to see pediatricians and family doctors may have been challenging, and parents maybe weren't sure whether they should bring their kids in for checkups. And one of the questions we're getting is, whether they're due for certain things. So let's start, I guess, with the basic checkup, as we've called it. How often are you recommending that otherwise healthy kids come in to see their doctor for a check?
So I usually say after age 2, then it's once a year, unless they have specific issues. Before that, obviously, there's a lot of visits for immunizations. After age 2, the important one is between age 4 to 6. There's some vaccines during that time. And then, outside that's just once a year, so not that often. But I have had a lot of families sort of missing those regular checkups because of COVID, which in general is not the end of the world for a healthy child. But when it sort of compounds over time, and now we're getting into the second year of missed visits, then that becomes concerning, because we don't want to miss things, right?
Yeah, absolutely. And I would encourage, this is one where I would encourage parents that if your kid hasn't been in a year, don't be afraid to proactively reach out to your physician and say, can I come in? Because very rarely will you get pushback on that, saying, no, we don't need to see you.
Exactly.
Because there are periods of time, between 4 and 6 and their grade 7 shots. It's easy for physicians to be so busy with our acute day-to-day stuff that not a lot kind of run their numbers and say, Johnny hasn't been in, he's 8, he hasn't been in a year. So again, if
Exactly.
parents are catching that, definitely bringing them in, and then especially the teens, I find.
Yes.
And there's some important It's not as important necessarily to listen to the heart and lungs, during those appointments, but important conversations around smoking, drugs, contraception,
Mhm.
those kind of things. That
Mental health as well has
mental
been a
health,
big thing,
100%.
and that's getting missed a lot too. And we're kind of seeing a lot of that really spiking now.
Yeah, absolutely. So definitely, for parents, again, right up till age 18, I would say,
For
if
sure.
once a year, I think is probably reasonable
Definitely.
to push your doctor for a visit.
Yeah.
Another common question, obviously, we're getting is around immunizations. So most have kept up with their schedule, and I know most of us have
Mhm.
worked hard to make sure that no one's
Yeah.
fallen through the cracks there. But I'm sure some have fallen behind. So can you kind of walk us through the provincial immunization schedule here in Ontario and kind of what vaccines are needed when?
Yeah, so the most important ones are the what we call the primary series, so the infant vaccine. So 2, 4, and 6 months is sort of the first set, and then 12 months, 15 months, and 18 months. After that, there's no vaccines until the 4 to 6 year boosters, and then after that would be grade 7, which are normally done in school. Keeping in mind the flu shot too is very important every year. On top of that, so that's usually in mid-October, and I always encourage my patients to get that.
I know certainly last year, thankfully, flu totally
Yes.
disappeared. And I worry a bit that there's going to be a
Yeah.
uh, bit of kind of overconfidence with people not getting their flu shot because, well, we didn't see it last year. Do I
Mhm.
truly need it?
For
I
sure.
think the last thing we want, and the last thing we want, the flu coming back. And one of the things that we really want to emphasize with flu and COVID is that flu hospitalizations have always in kids have always been have always been an issue, right? And even in a pre-COVID world, so making sure that those kids get their flu shots.
Exactly.
Get back to the immunization schedule briefly. So, in
Sure.
terms of the scheduling, so certainly between 2 months and 18 months,
Mhm.
those are going to be done at visits. Can you kind of walk us through kind of from 18 months right up until kind of teen years, kind of when parents, what milestones parents want to be aware of there?
Yeah, so 18 months is sort of the last set of the infant vaccines, but I always see kids at age 2, which is really an important one for developmental milestones, like you said. So most specifically, their speech is a big one, and sort of their social interaction, and it's a good touch point for screening for things like autism spectrum disorder. And then the next few years, 3 and 4, are sort of big for like the start of school age. Are they ready for school? Are they ready to start junior kindergarten? And then after that, sort of all those things you said, like the mental health aspect, the sort of preteen aspect, which is sort of coming in sooner than the teens now, like those issues, like you said, contraception, drug use, alcohol, things like that. It's happening earlier and earlier. So we want to sort of have those conversations a bit earlier and not sort of put it off till the teen visits.
We'll take a quick break and we'll be right back right after this message. All right, welcome back, and we'll get back into our conversation with Dr. Danby. We'll get back to COVID now, I think, because obviously,
Yeah,
a lot of the questions we've been getting in clinic
for
are
sure.
kind of around that. So, right now, so obviously, 12 to 17-year-olds eligible for the COVID vaccine.
Mhm.
That age group, what are you telling parents? Kind of what's your messaging there?
Absolutely get the vaccine as soon as you can, especially now. Try to get it before school to have that optimal protection. There is, the small subset of pediatric patients that can't get vaccines for various reasons, like cancer treatment or things like that, or immunosuppression. But the group's very small. So in that situation, others, we just say, parents and other adults to all get their vaccines and protect those younger kids and kids that can't get vaccinated.
Hearing from some parents whose kids either went to school last year or homeschooled, what do you tell them if they have some concerns about sending their kids back to school in September?
Yeah, and I'm getting a lot of those questions, and it's a fair question because, there's still a lot of fear around COVID, especially in the younger children who can't get the vaccine yet. But I think it's a balance of safety from COVID, but also, the detrimental effects of mental health, not being in school, not being around their friends, and also sort of the educational problems with missing school. I'm seeing this especially in kids with special needs or learning challenges who are sort of missing out on their learning supports, their EAs, all that extra help that's just not the same virtually or with homeschool. So I really do think kids need to be in school, and I think that's good step that the government has made to let kids go back. And I think if we just follow the proper precautions, so everyone who can get vaccinated, so all the staff in the school, kids over 12, and just following the proper precautions, and I think we can sort of optimize it.
With masking children, because so we have fairly great evidence now for the benefits of masking. So big
Definitely.
mass control trial in Bangladesh showing that
Yeah.
masking was effective. Some have raised concerns about kind of development of kids if they're wearing masks during the school year. Where do you kind of sit on that? What do you think about that when you hear that concern raised?
Yeah, I mean, I think we have good evidence, like you said, that masking works to help prevent the spread of COVID and other viruses. It's shown in the last few years, and so like just preventing the spread of regular common colds as well. So it's beneficial in that sense also. We have shown that kids over 2 can wear a mask and that it's usually not a problem. And even kids that struggle, we can sort of use different strategies, behavioral strategies, to kind of get them used to it. And it might take some pre-planning and practicing before school starts, but it usually can be done. There's very few contraindications to having your child wear a mask. Really, the big ones that stand out are very severe autism or sensory issues where it's very stressful for them to wear it. But outside of that, there's not really any big ones. So, I know some of the guidelines coming up are that they can take them off when they're outside and sort of socially distance. So I think that mitigates some of the social issues of not seeing people's faces and things like that. And again, it's a balance. So I think that should be ideal.
And I think we underestimate too, even with kids being masked in school, how many opportunities they have outside of school to be seeing people's faces, right?
For sure.
And whether it's at home where they're going to get most of their kind of social development, and then at recess, and then hanging out with their
and
friends.
Eating at lunchtime and things like that.
Yeah, absolutely.
Exactly.
How careful do parents need to be about cleaning surfaces, backpacks, clothes when kids get home from school? Because obviously this was something we were doing quite a bit early in the pandemic that things kind of changed. What kind of guidance do you give to parents there?
Yeah, obviously we were all really scared at the beginning and sort of didn't know what to expect. So we were hyper vigilant cleaning everything. I think we sort of now know that transmission from fomites or like inanimate objects are less, so we don't have to stress as much. So I wouldn't say not to do any cleaning, but I would also say not to stress too much about it. So not to kind of drive yourself crazy cleaning every little thing every single day, because kids are going to get dirty and, just the normal kid stuff. So I think just within a reasonable amount.
And for a lot of us, it's kind of been a transition out of that kind of fear. I think only in the last month have I started, when I go to Subway, I actually grab the handle.
I know.
Or I was grabbing it with my sleeve. It's taking a bit of an adjustment.
Or like elbow or
exactly.
Totally.
So kind of getting away from COVID again. So a lot of us are getting forms from parents from schools to complete with kids with asthma and allergies. There's the kind of basic forms we get. Anything that parents need to be thinking about who have children with asthma and allergies, like how many EpiPens, how many Ventolin puffers they need? What kind of guidance do you give them?
Yeah, so there's no like one size fits all approach, but you kind of want to think of like, where is your child spending their time? So I would say 2 at a minimum, so home and school. But you want to think about too, like if the child has separated parents or that live in 2 different houses, 1 for each house. If there's a grandparent that, watches them a lot at their house as well, you might want 1 for the car as well, in case you forget to bring one, then it's sort of there if you go somewhere. The other spot is kids who play competitive sports or sports that they're doing quite often. If they have like a gym bag, they use to have one in there too, because exercise can be a trigger, especially for asthma. And then just making sure that they have the proper paperwork filled out for school. So like an action plan or an emergency plan if they have symptoms.
Absolutely. And one quick tidbit I'll give to parents too. So the form that we're given here in London from the school boards is, I will describe it as essentially useless. You'll know this having filled it out.
Yeah.
Text, and in an emergency situation, the odds of that teacher reading my scribbles is really low. So what I often tell parents to do is to ask your doctor for an allergy action plan or an asthma action plan. And you can find these online and actually have visuals.
And color coded. Yeah,
absolutely. They're great. And I tell them just to like have the teacher put that on the wall. Because in an emergency, no one's going to read that kind of text. So and a lot of docs are just kind of filling out the forms just to kind of get, so thinking about those visuals, I usually recommend.
Definitely.
Talk about some skin stuff. So as we hit winter months, dry skin and eczema, obviously you and I are going to be seeing a lot with kids. What are some kind of tips you give to parents for kind of prevention? If they have asthma, eczema, or their kind
Mhm.
of tendency towards dry skin, what kind of advice?
Yeah. Yeah, so you're right. Prevention is sort of the first step. So moisturizing at least twice a day, sometimes more if they have bad eczema. So um, it's not so much important the brand that they use, it's more just finding one that they're going to use and that sort of doesn't react badly with their skin. Using that several times throughout the day. There's a bit of a misconception around bathing too, that kids with eczema shouldn't have a bath every day and that dries out their skin. And really, they can have a bath as often as they want. It's just that you need to moisturize right when they get out. So kind of pat them dry when they're still a bit damp, just slather on the moisturizer everywhere. And then, if they do need prescription creams, to sort of use that in addition as needed. The other thing I tell parents with eczema too is that it's sort of a stubborn illness where it comes and goes and it moves around the body, and it sort of doesn't matter what you do, it's going to keep doing that. And parents get frustrated because they think they're not treating it properly or they're doing something wrong. But really, that's just kind of what it does. So you have to just stay on top of it and kind of follow it around wherever it pops up. And the other thing I would say is like a humidifier in the house or in their room for nighttime can really help with the dryness, especially in the winter when you have the heat on.
So we've got a few minutes left. We're going to finish off with a bit of rapid fire. So I'll name a
Sure.
semi-controversial topic in
Okay.
and just give me like a kind of a quick kind of Cole's notes about what your first kind of reaction to this is.
Sure.
So here we go. So first, trampolines.
So this one I find so tricky because I had a trampoline when I was younger and I loved it, but obviously didn't know what I know now. So my answer now is no, just because they're so dangerous. As fun as they are, I just see so many injuries in kids. Orthopedic injuries and fractures, but I would say even more concerning would be head injuries, whether they're falling off or kind of bonking heads with a friend that's on it. And those can have a lot of long-term consequences. So it's just not worth it.
That's good. Multivitamins.
So usually not necessary. Usually kids should be getting their vitamins from their food. If they're eating a general wide variety of foods, then they usually don't need them. I usually only kind of recommend them in kids that are extremely picky eaters. And if parents are worried, and it sort of makes them feel a bit more confident in what they're getting. But for the sort of average kid, I don't usually recommend it.
Which is tough to hear because we grew up with such glorious
I know.
memories of Flintstones
The
vitamins.
Flintstones, yeah.
Absolutely delicious, but turns out probably didn't do a darn thing. So yeah.
Probably not. Just candy.
Yeah. Sugar sweetened beverages.
I would say just as a treat, should not be a daily beverage by any means for children or adults. I usually say milk and water are the best things for kind of day-to-day fluids. If it's a birthday party or special occasion every so often, then that's totally fine, but it shouldn't just be it shouldn't be every day.
Okay. And kids hate me when I say this, but that includes chocolate milk in that.
I know. Yeah, just white milk, regular milk. Yeah.
Again, chocolate milk and Flintstones vitamins growing up. We were doing all the right things. Yeah.
And trampolines.
Probiotics.
Yeah, so we used to think that they could help certain illnesses like a gastroenteritis. There's a lot of newer evidence showing that unfortunately they don't do a whole lot. The only time I sometimes will recommend those is in really young infants who are having a lot of sort of GI distress and gas and sort of belly aches, and it can be helpful. It's a bit anecdotal, and it's sort of one of those things where you can try it and it might help, but it might not. But it's relatively safe to try. And, at that point, parents can be desperate because no one's sleeping and everyone's exhausted. So that's usually the only scenario I recommend it.
And lastly, swaddling.
Yeah, that's a good one too. So, when I work in the newborn nursery at the hospital, every baby is swaddled in their little cot. So parents go home thinking that sort of this is what we do. And for those first few weeks when they're brand new, it's usually okay. But I usually tell them as the baby gets older, even a few weeks where they're sort of stronger moving around, if they can sort of break out of the swaddle with their arms, then it becomes dangerous because then it's sort of a loose blanket in their crib, which increases the risk of SIDS. So I usually recommend a sleep sack. So you can get those with the Velcro or the zipper. There's all different kinds, whether they want arms in or out and how tightly or loose they want to be. And every baby's a little bit different. So sleep sacks all the way.
Well, thanks so much for this, Dr. Danby. It was super helpful, and hopefully everyone got some benefit and some questions answered. And hopefully parents and kids have a good school year. So again, thanks for joining us.
Yeah, no problem. Thanks for having me.
Thanks again to Dr. Danby for joining us. And a reminder, obviously, to any parents or kids who have any questions for their family physician or pediatrician, don't hesitate to reach out. And until next time, stay healthy.